Okay. The healthcare subsidies expired at midnight. And this is what folks are going to have to deal with. This is what one couple is going to have to deal with. But this is an example. But many, many people, especially if you are on the Affordable Care, if you have affordable on Obamacare or the Affordable Care Act, you're going to have to deal with these skyrocketing premiums. And even beyond that, here it is.
Carla Zimmerman. I just retired in June from 25 years of teaching.
My name is Bartley Armitage. I've been in Eugene, Oregon for most of the 45 years. I was a union carpenter for over 30 years and still a member of the Carpenters Union.
Our current premium is $443 a month.
Through the ACA.
Through the ACA, and which is manageable for us, both retirees. However, it's going up to $2,224 a month. We are kind of in shock. That's without the subsidy. With the subsidy, it's manageable for us. We still live paycheck to paycheck, but it's manageable. The Affordable Care Act, we sort of counted on that in the interim period as retirees to sustain our health care. Without the subsidy, we honestly don't know what we're going to do.
Without the subsidy and with that kind of increase, it's like buying another house and trying to pay for two houses at the same time. Yeah, so we don't know what we're going to do exactly. We don't know how we're going to have some health insurance and be able to afford it on a monthly basis.
The thing that gets me the most is that both of us have worked our whole lives. I always had faith that our government would, when we retired.
The government, that our leaders would have a heart and try to find a way to help everyday Americans.
What I would say is this government should be about we the people, not about some.
Doctor, they're not alone.
They're not alone. 20 million Americans will be affected by the lack of subsidies. And what they're sharing as far as their increase in the premium is not just some one-off. According to the Kaiser Family Foundation, the average increase in premiums will be 114%.
Wow.
And that's, which means, of course, that some people have higher increases than that. And so when you start talking, you're not talking about Americans, just like they say. You're not talking about people who are sitting around or looking for a handout or give me. You're talking about working Americans, people who perhaps don't qualify for Medicare or Medicaid, people who are small business owners, people who don't have insurance that's provided by their places of work. We're talking about farmers. We're talking about ranchers. We know, of course, this administration was supposed to be so pro-farmer. It's really going to hit. And one thing that I just don't think enough people fully understand, when we're talking about cutting these subsidies, which we know this is something that is a Republican issue, the Democrats wanted to hold on to the subsidies. Well, 3/4 of the people who are enrolled in Obamacare or the Affordable Care Act actually live in states that Trump won in 2024. And so if, the people are thinking, okay, yeah, we're getting rid of subsidies, we're sticking it to the libs, we're sticking it to the Democrats. No, it's going to affect everyone, both sides, and even Republicans in many cases more than Democrats. That shouldn't matter. But to those of the who are like to be on one side of the aisle or the other, they need to come on to the middle and let's figure this thing out, because people are going to lose health care. You think you can go from $443 to $2,000 a month and not feel it? That's not going to be sustainable for many households. So what's going to happen? They're not going to have health care, and we're going to be making America sick.
Yeah. One more thing I want you to respond to, and this is Donald Trump being asked about these subsidies.
At the end of this year, those extended Obamacare subsidies expire. What's your message to those 24 million Americans who will see their insurance premiums go up?
Don't make it sound so bad, because obviously you're a sycophant for Democrats. You're obviously a provider of bad news for Republicans. Let me just say,
it's not a sycophant; it's a sycophant, by the way. And he said, "Don't make it sound so bad." It is bad. It is bad. But just go on, because there's something I want you to hear, and I want you to respond to it, Doctor.
Something. The Republicans, I think I can speak for Tom and most other people. I think what most Republicans want to see is what I want to see. And I leave it to them, and hopefully they're going to put great legislation on this desk right here. We want to see all of the money that's been squandered and given to insurance company, because Obamacare is horrible health insurance. It's far too expensive, and it always has been. But what it really is a way of making insurance companies rich. We want the money not to be paid at all to insurance companies. You know, insurance companies have gone up 1,700% over a short, meaning the stock, 1,700% over a short period of time. And they've taken in hundreds of billions and even trillions of dollars.
Okay, that's enough. Now let me
We
tell
want
you.
the money to.
Okay, this is what I want to tell you. Remember when Obamacare, or the Affordable Care Act, was put into place, when they were legislating for it and fighting for it? They wanted something that was much stronger. They wanted universal health care, and they did not want the insurance companies making so much money. That's what it was for. But Republicans fought it so much because of the lobbying, right? And because they didn't have a better plan. Let's just say, I'm not giving an, I don't believe that it is true, but let's just say what he's saying is true. Then he needs to blame the Republicans for not helping Democrats when they were implementing the Affordable Care Act to make it better, and to what? Improve the numbers so that healthcare companies would not be making so much money. And even not just when they were implementing it, they had time to update it. They had time to change it in the interim without dropping everybody and getting rid of something. And then I'm going to show you about, him saying that there's a plan in Republicans. They've been saying repeal and replace for years, and nothing has happened. So it could have been better, but it was the Republicans' fault that it's not better. Am I wrong?
You are right. And as I sit here and I listen to him, this is not his first term. He had a term in 2016. He had a little break for 4 years while President Biden was president. He could have still been thinking about the repeal and replace. He came back. He had a debate with Vice President Kamala Harris when he said he had a concept of a plan. He's had many, many, many years to come up with something that's better than Obamacare. He's had that time. Senators, congressmen, Republicans, all about have had the time. They have not come up with something that is better. And now we're seeing over 20 million Americans being affected by these increases in premiums. And he still wants to tell us, don't believe your lying eyes. He doesn't have a good plan for healthcare. Right now, the Affordable Care Act, though it could use work, is the best thing that we've had. So he's about to really feel it. And I really believe that the Republicans are as well.
Give us some news going into 2026 on health or something. If there's something positive, I hope, Doctor. I'm trying to start the year on a positive note. What say you?
Okay, let me think. What am I not going to talk about? So I won't mention the measles, because we have the highest cases, over 2,000 higher.
Oh, Lord. RFK.
I won't mention that we're about to lose our elimination status. I won't mention that RFK Jr. has supported cutting billions of dollars from research of the NIH, which is the world's largest sponsor of medical research.
When you say elimination status, for what?
For measles.
For measles.
We had eradicated the measles in 2000, but now with this outbreak, with the cases and with the deaths, even we're at risk of losing that elimination status, saying that it's no longer eradicated. And so I'm not going to talk about that because that's not positive. I'm not going to talk about RFK Jr. cutting almost $500 million from messenger RNA vaccine research that can actually help to cure cancer. So I'm not going to talk about those things. What I will say, as far as things that are positive, is that we each have control to a certain degree of our health. Despite what's going on with insurance, there are certain things we know as far as lifestyle that can help us. We know that if we exercise, according to the American Heart Association, it's recommended that most adults exercise for 150 minutes of moderate exercise per week. That's about 30 minutes, 5 times a week. So that's one thing that can be in our control, getting out, moving our bodies. We can cut back on salt. Most Americans should have less than 1,500 milligrams of sodium a day. Okay, we can do that. We can also do things like meditate. do yoga, and you can, Google, look up on YouTube things to do. There's certain things that we can do as far as being in control of our health and our well-being. So I say that we lean into those, and very importantly, remember that we must be a part of the process. If you sit back and you don't vote and you say, my vote doesn't matter anyway, let other people make the decision. If you say that, then you really don't have a right to complain. So I say, let's control what we can control as far as our health and as far as our voices politically. And that's pretty much the best we can do.
Thank you, Dr. Frita. I really appreciate it. You gave us something. Now, when I say positive, it doesn't mean that you don't have to tell the truth, right? I'm just talking about our attitude and our spirit, because there's something that can always be done. And I'm counting on 2026 for that something to always be being done. Yes. I know that's bad grammar, but that's where I am. Thank you. Dr. Frita is a triple board certified nephrologist and a medical expert in internal medicine, pediatrics, and obesity medicine. She does a live stream on her YouTube channel every Monday at noon Eastern time on trending medical topics in the headlines and celebrity health. By the way, I know that you are not Donald Trump's doctor. You're not advising him. But if you had a patient like him and it had all of these symptoms, what would your medical advice be for them?
My medical advice would be to respect medical advice. I would explain that we don't get our degrees and our board certifications based on superstition or based on a hunch. I would ask him to understand the years, the decades of study, and to understand that even when your physician makes a decision, it's not made in a vacuum. We go to other colleagues, we go to organizations. It's very, very thought out. And so I would ask him to respect medical doctors, to listen to the advice, yes, ask questions, but to understand that his arrogance will be to his detriment if he doesn't listen to his physicians.
Thank you, Dr. Frita. Very good advice. And just so I want to show you guys this. Thank you. We'll talk to Dr. Frita later. So this is what I want to tell you guys about. Again, just because I want to have a positive, I want you to be positive. I want you to feel that you have agency and that there is hope in this world. And there is. I want you to believe that and know that and live in that. But that doesn't mean that you don't tell the truth. That doesn't mean that you sugarcoat things. That just means that you look for solutions rather than just problems. Okay. So, which I don't believe the Republicans are. And I know Donald Trump isn't, and he lies. And as I said at the beginning of this, you do not have to fall for the okie doke. When someone has lied to you once, they'll lie to you again. And if they keep lying, then what are they? A liar. And Republicans and Donald Trump have been liars about healthcare. And here's the proof that I will show you. Here it is.
The truth is, they've always said they have a plan, but they've never had a plan. Let me just go through a list of things here. In February of 2016, then presidential candidate Donald Trump said, we're going to replace Obamacare with something so much better. Nothing followed. On February 27th of 2017, the president said, we have a really terrific, I believe, health care plan coming out. Never did. May 10th, 2018, Donald Trump said, but wait till you see the plans that we have coming out literally over the next 4 weeks. We have a great health care plan coming out. Nothing happened. At a press gaggle near Air Force One in May of 2019, he said, we're coming up with a great health care plan. We're going to have a fantastic health care plan that's coming out in the next 4 weeks. Nothing ever materialized. June 16th, 2019, the president said, we're going to produce a phenomenal health care plan, and we already have the concept of a plan, and it will be so much better health care. Yeah, well, we'll be announcing it in about 2 months, maybe less. Nothing happened. Fox News interview, the president said, we're signing in a health care plan within 2 weeks, a full and complete health care plan. Nothing happened. July 2020, the president said, well, we're going to be doing a health care plan. We're going to be doing a very inclusive health care plan. I'll be signing it sometime very soon. It might be Sunday, but very, very soon. Nothing happened. August 3rd, 2020, the president says we're going to be introducing a tremendous health care plan sometime hopefully prior to the end of the month. It's just about completed. Nothing. September 15th, 2020, the president says you're going to have a new health care. We have a whole bunch of alternatives to Obamacare that are 50% less expensive and are actually better. Nothing. Never happened. September 10th, 2024, ABC News presidential debate. He says, I have concepts of a plan. You'll be hearing about it in the not too distant future. Nothing happened. December 8th, 2024.
Okay,
He said,
we're gonna be here. We'll
we
be
have
here all
concepts
day
of a
to go
plan
through-
that will be
to go
much better.
through-
You'll see it very soon. Produce nothing.
We go through from there all the way up to now. And so we'll be here all day. If we just, the lies, people, we have to somehow come back to reality in this country. There's so many lies. And he's expecting you not to believe your own eyes and your own ears. And I hate to say that every single time, but it is just, it's unbelievable. Unbelievable. Thanks so much for watching, everybody. Your support means the world to us. Don't forget to hit that like button and subscribe so you never miss a show. We're live every weekday at 10 a.m. and 5 p.m. Eastern Time with new clips dropping at 2 p. and 8 p. And if you want even more Don Lemon Show content, join the Lemon community. Members get exclusive posts, behind-the-scenes videos, and live chats just for you. So hit the join button or visit our channel page to sign up. Thanks again for all your love and your support, and I'll see you next time.